Why everyone watch Frankie? Good job, Frankie.
Yeah.
So as everyone did some research on the anatomy part and stuff, right?
I read your thing. Man,
Don't be Friday's class and just kind of look at me like a lost soul. Because that kind of translates to every case you do. What research did you do, you know?
Perfect.
I'm not expecting you to do a lot, but you should know.
Go lobe to the left. I'll walk up with you.
Since we gotta find, maybe you guys can look around for it. 2 Wheatlanders. Can someone search some trays? I have a couple of trays here. 2 Wheatlanders I need to get.
Somebody else grab
I got you.
Yeah, good.
Give.
All right.
So the indicator looks good?
Yes.
No holes, no strike through, good?
Mm-hmm.
Yep, I realized what I did.
How are you going to correct that?
I'm gonna put my ring stand on, move that over there.
So silent. Silent night. On TV? Hmm.
Good.
And then copyright law on my video.
Oh, that's fine.
They just monetize. I can't be.
Promise you'll put some free music in the background of the video.
Sure, I could do that too. That's a good point. I can do that. But then I would ruin my voice or something. But who wants to hear my voice anyways? Except me.
Your subscribers.
The 15 that actually watch. That are from India.
I want to.
Yeah. Are you from India?
I don't have time.
Yeah, time.
Maybe after externship when I have time and I'm not busy.
It would be,
running
and the reason I do it also, it would be really, if someone did it for me like 10 years from now, go back and see yourself, it'd be nice to kind of remembrance of your and how,
around. I'll probably go back and watch it. But
yeah. Yeah, it'd be
life
kind of
is so
cringe.
crazy right now. that,
No,
like,
you have a lot going on. And I
you
do,
have 5 minutes to sit down. It's like 5 minutes.
I do like to try to, I'm doing a lot of CSD stuff. I like to, and those are doing really well. So.
Kind of a movie you watch that.
There is a think button now. You can push and donate money. So $2, $15, whatever you can afford. So, and it goes towards you guys. That's not my money. Whatever money I collect, I buy gas cards for you.
I like that.
So that's my objective is I'm not trying to profit because that would be solicited. That wouldn't be right.
That would be illegal.
My whole goal is to try to get something for you guys for externship. So if you were running low on gas, because sometimes that's expensive, right? And based on last night's debate, it's going to get higher. Poor Trump. He didn't know what he was doing. Get used to saying Kamala. Yeah. He just got under his skin last night and he was just falling for every trap. Yeah. And if you know Trump, he can be a little annoying.
I don't like this at all. Now you chime in and help, because I like the way you had yours.
Oh, she has a picture.
Well, let me, I want to film this so then I can at least get this part for the next class one and see that too.
You can go ahead, go ahead.
You need your purse.
Two of them? That's what I'm saying, though. I know that I'm not setting up properly, but
It's okay. You're doing it right
these
now.
are the right ones, right?
Something that's gonna help you think.
Yeah, go ahead, tell me, please.
Think what is gonna be used first.
Mhm.
What is the surgery gonna need first?
Right.
So 11 plate. And then after that, what do you do next? There's something.
Right here. So that it's not. And then it would be this. I'm lost, I don't know.
You're-
That's what I'm saying, I'm not
You're
ready
doing
for this
fine.
at all.
Right.
I think that was the set up on there. That's good. Now she can grab that.
And then Fricky, come over here and grab this, but don't put it on your field. I gotta check the.
Okay. Wash your back. Yep, thank you.
All right, no holes, no strike through. Good.
Indicators good, right?
Indicator's good.
Okay. So the objective is just get all those wires in there and lay them in there like so they can get organized, and then you can lay your drapes.
So I can grab this outside of just the handle, I'm allowed to
So
touch it
I would just
anywhere?
lay that somewhere on your
Just lay it
table,
somewhere
and then
on
just
your
grab out all your wires and then give Haley the tray, because that's only the best way I can do that without trying to.
And then you can put your bovie underneath the bowl
Put it under the bowl
with the bovie
With the-
sticking out, so you can visualize it during a count.
and yank hard too.
Yeah. Okay.
What about the tubing for the yank hard? Does that go in there also?
Just leave that for right now. It's fine. Just put that on the very bottom. I would leave the bovie. I'm sorry. Leave the bovie in that tray too, because we will be using that if you have an L hook. The yank hour you can leave right there, because that's only if we go open, right?
Okay.
It's fine. But the suction, traditionally I told you to put it on the bottom, but it's falling and I don't like it because most places
Pass
don't
this
use
off?
3/4.
Yes.
Pass it off.
Thank
It really
you.
is just something I can get the instruments or stuff to you in some fashion. So then you can actually put the drapes either over there is fine, or on top of that ring stand is what's up to you, okay? Either one's acceptable. But make sure they're in the order you're going to use them, right?
Right.
Okay. So the first thing should be your doctor's gown and glove, right? 3/4, 4 blue towels, and then the laparotomy tray. And make sure you have extra blue towels for when we go open too, right? So we can go for that.
Thank you.
Yes, ma'am.
Careful your finger. There's gonna,
Finger.
Down gloves. Feet first. What am I doing? These are not the front of this. And
so go in reverse order, right? So what's on the bottom?
down and gloves would be last because it's
Be
right.
first.
So the very first thing that's going to go down is the left.
Correct.
And then your towels,
Correct.
3/4,
Correct.
down gloves.
So yeah, go in reverse order. So it's the gown and gloves on top, right?
You're going to hand off the gown and gloves.
So here, watch.
So I am doing it. I'm doing
So-
it in reverse.
Yeah, there you go. Yeah, perfect. Yep. Because you think about it, the first thing you're going to do is
Gown
the
and
thing
gloves.
that's on the top going downwards, right? Perfect. And just to be anal retentive, which
Yes.
one is going to go first? Right. Gown.
Gown
To
gloves.
be really, really, really anal retentive, you
Go
have
ahead,
these
open it,
open.
ready?
Just one less thing. It just
Perfect.
because when you're there, you gown them. You don't have to worry about opening. Just open. Put the gloves on, right? So we're going to go through a count with you whenever you're ready. Do you have your ties and stuff ready to go?
No, I'm doing that right now.
Okay, so they're in a nice package. You don't have to take them out of it.
Okay.
But I want to show you kind of an easy trick. So you can put them in this blue towel, but since they're like this, you can just take that off. You can throw that away, right? I usually just take the non-perforated one if it's not being used.
Okay.
And I just have those where they're on my field like that. I can grab them. Okay. And then maybe have one that's when you go open, make sure we get some ready for like on a pass or like the tonsil plant. But all this stuff you're doing is just anticipating. Make sure the 10 blade's loaded, because all this stuff is anticipating to go. We are going to go open, right? But you don't know that, but in this case you do know that because we are. Make sure you're ready for that, right? And as soon as you are ready for a count, we'll go through that with you, okay? Because we're going to go exactly what we do in that final evaluation. I'll go through a count. You know what tray we used or no?
What tray?
Yeah, was it 1, 2, or 3? I think.
No, it says it on the tray.
Where is the tray? On the lid, maybe. Yeah,
Should be on the other side of the
I don't see it over there. It's weird.
Just is it?
What's the other tray say? 2. This says 3. Does the other one say? What's it? That's 1. Does that say 2? Yeah. Yeah. Are you ready for a count?
ready for a count.
Okay. So good. Yeah, this is typically perfect, right? We're ready to go. Any questions so far? So what I'm going to do is base my count on here. I'll come count with you and I'll mark everything down. All right, we'll start with a soft count and then we'll move into instrumentation, okay? So we'll go for are you ready? We'll go laps first.
First.
One, 2, 3, 4, 5 laps.
Okay, so let me just think about it. Not to be like really picky, but when you count, I want you to like play in cards. You're putting stuff to the table. Like 1, 2,
Okay.
3, 4, 5. So just go ahead and do that one more time. Sorry.
1, 2, 3, 4, 5 laps.
Ratex.
1. Do I need a point more? Or
No, that's obvious. It's separated, right?
2, 3, 4, 5, 6, 7, 8, 9, 10 ratex.
Outstanding. Any hypos?
Hypo. 1
1. Any blades?
blades. 1, 2 blades.
Okay, good. Any bogey tips?
1 bovie.
Okay. Sutures?
1 suture.
And we're going to do the stringer first, all right? We'll start with perforated towel clamps.
I have 1, 2 perf.
Okay. Should have 4 based on this tray. This is 3, right?
It's
1.
1. Never mind.
Hold on.
Brad has a problem. It says 4.
I missed that. That's
Says-
my bad, because there's 2 over on the mayo, so I missed that.
All right, good.
My bad, 4.
All right, so we'll start with perforated towel clamps. Do it one more
We
time.
have 1, 2, 3, 4.
All right, non-perforated.
I'm used to using, can I still, even with the blade on? Because I used to use these to but probably not with the blade on it, huh? Just do one of those? Or?
Would not want to use it.
That's
Blade.
okay. All right,
Yeah,
so
just use one of these as the back, and we'll just make sure when we count 4 steps we know, right? So
so
non-perforated. Yeah.
1, 2, 3, 4.
So here's the back end, which I haven't really showed you in the sense of the case. Don't mind if I take it.
Oh, I forgot I had
Frankie, are you
some.
happy with this? Looks very nice. You did good. Now, one thing.
I don't know, I gotta get over being too
too. Like I just want to make sure I didn't really.
Be perfect and everything. I know. I know.
My nail!
The only thing we didn't do is get medication and irrigation to the field, but we will do that too. I brain farted on that. But I figure everyone knows that routine, but we're going to pretend that we do have that.
Can I go and put these on?
No. Frankie, don't scare me. Why would you not put your light handles on now? Because there's no barrier between this table and you'll be reaching over. So it's a common mistake. You will probably see some rebel out there do it. Doesn't make it right. Because you should never ever go over a field.
It's just remembering which end that we're at. Right?
That's correct. Right, so the lower lock side you keep because that's going to go on the various needles. So it'll go to me. But I want to make sure it's tied down up top because that's where we're going to put the Varus needle. You don't have, nope. That would be at the top, all of it. So just tie it down and kind of.
So I can put this.
Yep, exactly. Nice. If I can only use words, that would be perfect. Words are hard. And kind of run into the same thing with the camera. Same.
Camera up here.
Nope, this is the camera going down that way. It's the same
Down that
kind of
way,
area.
okay.
You got it. And yep. Nope. You're right for that.
That's the only thing is I'm unsure which.
If you're not sure, ask.
Okay.
All I can say, it's okay. I'd rather you ask than throw it off. And that's the last one we have, right? I'm testing the light. Is it working?
Yes.
All right, on standby. And we'll wait on that, okay?
Oh yes.
So when we go open, we will pass it off.
We
Suction.
don't need Bobby yet either.
At this time, no, right?
So then this I can either shove right there or bring over.
I would shove around there so Frankie knows where it's located. And you come back over to be my assist, which you're going to be on this side. If we go open, I want you to remember, Frankie, that we need to have a Bobby passed off and a suction passed off. So now, are you comfortable with this here? Maybe we don't bite. Can you get this a little higher, maybe?
Yep.
All right. Are you comfortable with reaching stuff?
Yes.
Is this too far for you? Trying to reach that, or
I don't think so.
because you can? Okay. This is the key. Are you comfortable with this and changing over? Okay. So I would check this, put this on the here. So I'm going to be coming in a minute. So while I'm doing that, I'll look over it, which is fine. I want you to start making sure this camera is loaded. Do you remember how to do that?
No, I don't.
Does anyone? So this is our fine, right? So we know this has the light camera, so the light goes in here. And this is the camera, so you just push down on that. It goes in there, right? So you can have it ready to go, put that there. If you, sometimes you don't want this to fall, you can just get a hemostat. So just hold this the whole case, okay? All right, I'm coming in. So I want Frankie, whoever is the scrub tech that set the case up, will gown the doctor. So this is another evaluation. Are you doing that properly? Are you introducing yourself? Right, that's important, right? Am I wet? So dripping, right? These are all things. So I'm not wet. Some doctors say no, they'll use the alcohol rub, but you should know if he's wet, it's just dripping water down. Doing good job, Frankie. All right, so timeout. This is going to be laparoscopic appendectomy with the possibility of going open. We had 2 grams of Ancept. It is a level 2 fire risk. Does everyone agree? Does anyone have any concern to go up? Yeah.
Any allergies?
Allergies. Is there any allergies? Anesthesia? There is no allergies on there. This is Mrs. Jones or Jim Bob Cooter. Right, I agree. So we'll go through a basic timeout. We'll assess that we know it, and everyone knows a timeout, what that involves. And then we're going to go through the motions of trocar placement. And then Delaney's going to help me, right? Can we get the light off, please? And eventually I'll have the light turned off so we do this in the dark, because that's realistic. And are these 7s? Tight.
7.5.
I can barely feel my finger. Alright. Except the 7. It means I have to do
There's not.
12.
Would
So,
you rather us go?
nah, because then I'm like an old wrinkly man. I'll find my gloves for me. So we'll go with it. We're going to put the, good, timeout's complete. And we're just going to go through the motions, and you just listen to me, right? And I'm not going to need a skid marker. I'll have the local, please. So all really at this point, you're just listening to the doctor and anticipating things, right? Sometimes I won't even ask. What do you think? What's next? Okay, plate. Incision. Right back. There's needle.
She's so thirsty.
There's needle.
I was like, yes, I am.
Insufflation on. Then I'll turn to you and ask some questions. What is insufflation?
Air going into the abdomen.
Yeah, very good. What type of air? What type of gas?
CO2.
Very good. What is the nominal time or pressure it needs to be at? You're looking on that machine over here behind my. Yeah, good. So it's 12 to 15, no problem. So high flow. All right, we're going to put in. You hold this right here, Delaney. All right, local. So make sure we put it back in the same area because they're going to be kind of a routine. Very good. Injection. Oop, sorry, patient. Good, so great. That's what I want is the anticipation. Right. What do you think next, stroker? Make sure it's closed and locked. All right, camera, and then we'll wrap the camera. We're going to switch this over to Lenny here, okay? Take this off, switch it over here. Lights on.
Right here on this one.
Nope, this one. And then we'll open it up.
Where's the light?
Back flow.
You want me to allow?
Yes, I'll take it off. Beerus needle we're done with. Camera. So you're going to help me, Delaney, okay? Everyone that's assist helps me. My camera doesn't work. That sucks, and I have a bad neck. Awful. So, can you be my surgeon? Hold that. So what I want you to do is we'll switch this around. And we're going to go in, and we're going to watch, try to find where I'm palpated. Center that, right? Yep. Local. Don't move. Blade. Five. We're done with Ferris, then you can lay it back
Yep.
there.
What did you ask for? I'm sorry.
Five.
Five.
Yeah, so again, this everything's in the order we're going to use it, right? Locked, good, arbitrator. Follow me down. So load this up for the other five.
The other guy.
Swing me around here so you can see me palpate on another one. Keep going. You're going to have to kind of go this way a little bit. Okay. You see me?
Oh, okay, there you go.
Center that. Good. Stay right there. Local. Good.
I'm not gonna judge us on this part, are you?
No. I judge you on it.
This
You can just
is really hard.
if you can just follow directions I'm looking for, and that's the real life. I mean, no one's expecting you. Can you listen to what the doctor's saying? That's all. You're doing fine. Of course, I'm not gonna fail anyone here. Long hole, Brad. Go down. Very good. Can I get a Maryland or some kind of one of these? Yeah,
Locked. Right?
they are locked. Yeah. Thank you.
That's more of a double.
No, I appreciate it. There is no. Good. So you see me? So I want you to hold the camera. See this in on here? Swing this all the way up. You can use your other hand. Swing it all the way up. It's funny go that way. So swing it all the way up. All right. So again, try to find that trocar. There. So can you center that? So find me going in. All right. Find me going in. Good. All right. Burp that out a little bit. Is this focused? Focus it. Turn that around. Go the other way. Get this as good as you can. And this doesn't articulate. That sucks. Or it does. I wish I had my camera. All right. Good. So we're going to come in here. Find this another grasper. I mean, do you have a scissors? Laparoscopic.
Grasper.
Oh, sorry.
No worries. So how you pass this is pretty much if I'm holding it out, just you can hold it there and just kind of come in.
Bottom.
Yeah, just kind of go into her hand, right? Hold your hand out.
Can I do that again?
Yeah. Yeah. Transfer. Very good. And sometimes a real good assist will help him get it into that because he's trying to balance. But You see me? All right, good. Going in. So if I can get this camera to work, it'll be better if I can look forward. But since my neck is killing me, I can't look very. We're going to go through here, and I want to say to you, at this point, we got some trocars in, we got some instruments in. Tell me a little bit about the anatomy. Why are we doing this surgery? What is this surgery? Tell me something.
We're doing a appendectomy.
Good. Okay. So where does it live? What anatomy-wise? Where does the appendix live?
Cecum.
All right. So good. It's the start of the large bowel. Okay. Good. Tell me some landmarks that we're looking for. Tell me whatever comes to your mind at this point. I'm asking you. You know it's on the cecum. What else? What is the other small bowel that runs into it? That's the ileum, right? So the ileum, cecum. Other things I would like you to know a little bit about, I'll get to when we go open. Okay, so just whatever you can add to that conversation, I'll assess it, and it's okay. The theory of this is, can you think of this pressure and still think and still manage and kind of, okay. All right, we're going to go open here. So we're going to, at this point, get the lights on. Lights off on anesthesia. So someone would help me, but if not, I would just do it. So the objective now here, we'll slow down since you haven't seen this part. This is going to come out. We're just going to lay it down, right? Trocars will all come out. I'll do that, right? Take gas off. We'll release all the gas because we're going to go open, right?
Okay.
In the real world, I'm going to go pretty quick. And your evaluation, I'm going to give you some time to adjust to change over. But what I'm going to do, what I would need you to do as I'm taking trocars off, the first thing you should do is, what came out?
It was just really hard.
So get a blue towel and lay it on your laparoscopic tray. And anything that's laparoscopic, start putting it over there. Okay. And I'll give you time as I talk. Think about life. So all this stuff needs to come off, right? You were already getting your 10 blade there. That I like that, but the reason I wanted everything off this, I'm going to show you why.
Okay.
Because you don't know, there's blood, there's guts. We need to have a clean slate, right? So everything's going to come off.
You want to take
Everything off.
Okay.
And so think
Put another
about.
towel down.
There you go. So get a clean towel. Lay it right down as quick as you can. We need to do this quick, right? So here's what we need, right? 2 laps. And again, kind of thinking about what the first thing the doctor's going to use. 10 blade. Right? Okay, we'll lay a Metzenbaum scissors. So all this stuff is what you're going to do as quick as you can, right? What else? It's fine. Grab what you can. You got there should be a mess, right? There you go. Yeah, so we'll go with, think about as you're cutting down, right? Incision, right? We have the bobie, so we need a bobie thrown off. We need a suction thrown off. You should do that as quick as you can. So
That's something that first assistant did.
you can help. You can help. You can help. But realize
You
the
gotta throw.
machine is going this way. So
It's this way.
this way. So we're gonna kind of come underneath. Right. And make sure we just tie it down. The objective is to get this bobie. Don't throw your holster away. I don't know where your holster went, but you have a holster.
I need your holster, Frankie.
Yeah, that's Jacob 101. You can't throw that away, right? You need it for fire reasons. We will get tagged. And now this is also going to get thrown away. So I'll help, but so I want you to start thinking about that. Always go open, right? 10 blades, stuff up here. Bobie needs to be thrown off. Suction needs to be thrown off. Is it tied down pretty good? I'll tie it down here so it's not going anywhere. So
I didn't hear what else you said. Sorry.
okay, so think about 10 blade or blunt dissecting down, right? So we'll get some mosquitoes, 2 mosquitoes, 2 hemostats. I'll have that off the here so in case he needs it, right? Okay, hemostats.
Oh, this will make me crazy. I won't. I can't stand it.
What, me?
No, this.
No,
Yes.
it's his phone.
Yeah, I know. This is why I don't do tower roll. I just spend more time worrying about it. But everyone spends. They want to be perfect back here. That's the. So we got here. Those look like mosquitoes. Can I get the larger Kellies? 2 Kellys, large Kellys. So we have 2 mosquitoes up here already. No worries. So like Liam, or however you want. It's your field, right? So 2 Babcocks, 2 Alices, DeBakey's,
Already.
Maryland. I'm sorry. That's embalmed. What am I missing on your picture? I forget.
Oh, we didn't have the debate camp picture.
Okay,
That is everything besides
That's
the
fine.
treasures.
that's good.
Oh, and then we had
the Army Navy.
Oh, that's right. Army, Navy, and a Richardson Eastman small one. Yeah, that's just in case we need it. Very common. Whatever you want to put it.
Okay.
As long, I wouldn't put it over it because you might need to grab that. So however you do it's fine. We're good. We're gonna do this. The Bakey's probably added to it because it's a common thing we use. And where are your ties? You got your ties up there. So giant passer, good. You have one. I would take it right out of the package. So in case you need a free tie, you can just grab it and lay that on wherever you want, as long as you can grab it.
Okay.
I would lay personally. I would have my ties just like this somewhere, where in case you need to just grab it, you can just grab it and give it to the doctor, right?
So the debating ties are additional that we need to add on.
Yeah. Well, I think I've already set the ties, but yes, if I didn't, yes, please, because
Okay.
in this case we will have to be tying stuff off.
I
Okay.
just don't know if the pictures.
That's fine. I've adapted and changed here based on my mood. I'm just watching Frankie back here.
Meltdown over my
I
insurance.
can't wait for that final count.
Offset.
So your goal now is to don't worry about that anymore.
Okay.
Someone used to tell me surgeries happen up here
Okay.
because I was just like you. I would spend all my time back here, and the preceptor said, "Surgery's up here." So, but your instinct is you're trying to like, I need to know where everything is at every
Right.
moment at any time. This is important. This is number one important. But we start there, right? We know things live back there. We have to add to it.
Okay.
We'll find it. All you have to say is coming your way.
Okay.
And if you can't find it, preceptor's going to come save the day, right?
Okay.
So right. Good. So change over. I'll give you a little bit of time. Look like this. We're going to go open. We got a Bowie thrown off. We have a suction thrown off. Outstanding, right? So now we're going to go with it, right? Let's have some fun. If you remember the video, we're going to go with the template. Can I get 2 laps to the field? Now everyone's going to kind of play this role too. So when Frankie goes through the motions a little bit, we'll switch over and everyone kind of get a play on that. Yeah, hopefully I don't destroy. All right, template. So I'm looking at how you're
Oh
passing.
my goodness.
Don't be coming in all hot like that. What are you doing? So it's better to have it. So make sure it's not upside. These are the little things I'm looking for.
Let's try again. Do over.
Oh, template. Can I get 2 Atson with teeth? We have Bogey. Yeah, okay. And 1 to me, 1 to Delaney, please. I'm just going to kind of open that up a little bit. So you got right there. Kind of follow me along without ripping it off the table. Can I get Army, Navy? Lay down. So your job is to keep organized, right? Hold that back a little bit. You let go. Can I get 2 Richardsons, or at least, I'm sorry, Wheatlanders? So we cut down. We're gonna have to use the self-retaining retractor. Okay, good. It's a huge incision. Oh, this is the one that's broke, right? Okay. Can I have a hemostat? We have ties available.
I do.
Is that how you pass?
Sorry. No.
Is it clamped once? Is it clamped once? Say double whammy. So make sure it's clicked once. Hold your hand out. Make sure. Skid up.
Start over here.
So make sure just click them all right now. Just click them all while you're waiting. Just click them so you don't have to worry about it. But every time you get it back, click it once. Just make that a habit. All right, good. I know you're left-handed. That's hard. Hold that just like you have any ties. I got a vessel here. Don't just hold it. Don't pull on it. Hold it right. You have the Bakey. So I want you to anticipate what's coming next. I'm going to throw it down, put it where it lives. Should I see the tips? I see the tips, but like that. There you go. And then when you're opening when I say, okay? What do you need next, Frankie? I'm about to tie something. What do you? Shh, that ball.
Scissors,
It's finished for shit.
right?
That is absolutely correct. Open it up. Scissors.
Mayo. Street.
Straight mayo, please. Good job. Alright. Babcock, tell me something about what we're looking at. We said the appendix is living on the cecum, right? What else do we know? Can I get a suture, please? I'll have to do that while I'm here. That's how you pass?
No, it's upside down.
I'm right-handed. Did fine. Take a deep breath. So when you do this evaluation, grab a larger needle.
Yeah, I was trying to find one, but I couldn't.
No worries, that
So
can
it
happen.
doesn't have to be 3.
I would not practice on that. So small.
So just grab whichever one and make it big.
Well, you're eventually going to have to get used to that, but I don't want you guys to struggle on something you practice with so small. But you're kind of, so you're left-handed, right? That's what you're doing. That's fine. Can you pass with your left hand or like that?
You want me to pass with my right?
Can you pass because it seemed like, yeah, go ahead. All right. You don't have to slap it, just get in there. What do I need next? Can I get an answer with teeth? You're going to have to give me a second. I'm going to tie this down. I was supposed to do it yesterday, right out of time. Only the best here at Southern Technical College. Do me a favor, give me a DeBakey to Delaney. And just, I want you just to go in here and just hold that just like that. And scissors. Alright, here we go. Okay. Needle down. Babcock. Here's your driver. So you keep organized, right? Good. So tell me about the appendix. Look at this MacGyver job here.
See the cecum.
Could you buy me something, please? It is in the sequence. We established that. Good. What else? So what are we looking for? Mesoappendix. We need to get the artery ligated. So we're going to need. Here's how we're going to do it. We're going to do 2 ties. Right. Tie. Clamp. Or tie, scissors. I apologize. We're going to clamp, cut, tie. Does that make sense? So here's what we need. We need 2 clamps, 2 hemostats. And you're going to help me, okay? Good. Hold that. Don't pull on it, just hold it. Okay. You can take that off. Good. So we cut, right? Let's have a tie and a passer, please. Hold this just like that. Vicky? What I'm looking for is just what are you anticipating for, right? What's next? Not so much the surgery per se, because this is a really bad example of a surgery, but I tried, guys. I feel like the part's coming off. Scissors, good. You're doing fine. The reason I'm not cutting it because I need to use it again. Alright, good. Yeah, clamp it off. Good. Now I'll give that back to you eventually. Oh my god, it's falling apart. I give that back to you with a Babcock. If I gave this, use it. This is dirty. If it touches the appendix.
Yes.
So this needs to go somewhere in your area where you designated dirty. That's fine.
Okay.
And if you get your hands dirty, you would need to get new gloves, right? Now, we're looking at the appendix, right, that's off. What do you need to know? I'm asking you questions now, right? We know it's, right, there's a stump there now, right? That is dirty. The mesoappendix is attached to it, right? The artery we ligated. We took the appendix off with what? If we're laparoscopically, it's a linear stapler. In this case, if we're open, we're going to clamp and tie or use ligatures to tie it off, right? So we get it to your back table. It's a specimen. It's dirty. Now, what do we got to do with this stump? Inverted or everted? So we push it in, right? And then we use a technique called purse string suture technique, right? So those are the questions I want you to know. Purse string technique, right? Invert it. What else? Is there anything else you want to add to that? Not much, right? That's all I'm looking for. That you knew some things under pressure. As soon as we get to this point, we're like, okay, can I get another suture to the field? Because that one was off. Just something like a CT1 or some larger one. We get to this point, Frankie, we're going to reset for everyone else, and we're going to go closure. I'm going to let Delaney close for me, and then I'll reset, and then Haley will get over here and we'll go through the motions, okay? I'm not looking for more than that. But I want to see this final closure that you do it perfect, right? And what's the size needle?
0.
Yeah, that's fine, perfect. It's ties? And what is it?
It's a suture.
Oh, F1, okay. I thought you said ties. That's fine. Yeah. Sorry, I mean to freak you out. You ready to close roll?
I know.
Don't fall asleep on me.
I'm not.
I was so proud of this yesterday. It looks like a hot mess. Harsh stuff, Delaney. Look at that pen. Suture. Let's get yourself ready for a final count. Yeah. So this needs to be facing my chest. You're doing it with your left hand, that's why. You need to be passing it. Let me see something real quick. So, fine. So you're coming with your left hand, right? Because it's normal for you.
I think it's because we were told to twist.
Right.
Since me and your left-handed, you don't twist. You just hand.
Don't twist, just hand.
Yeah,
Makes
it's but everyone else is right-handed.
Right.
Let me see. Yeah, do it with your left hand. It's throwing me
You
off.
want to take it off and do it.
You're doing it fine the way you're loaded. It's just you're passing it backwards. Where the needle's facing you and not me.
So,
So this needs to become vertical. And somehow, that's why this needs to be on
Be on
this
that
side.
side.
That's why I'm saying if you can pass with that hand,
so
you'll be
then,
fine.
and then grab this instead.
And right, perfect.
Okay.
That's what I'm trying
Okay.
to say. That, I
See
mean,
what you're saying,
if it's not comfortable, I'm not really sure how
No,
you
no,
would
no,
do it.
it's fine. I
With
think
your
I'll
left
just,
hand, you would have to it'd be kind of like awkward like that.
No, it's
it's
fine.
weird. So
do that one more
it's
time.
better just to take it and go with your. But I understand I'm
So
right-handed,
load
so
it. And then
just turn. Right, and again, just remember you don't have to slap it in there. Just turn and just guide it into the doctor's hands. Right. And then just kind of go with that so it doesn't fall below the field and just kind of drop it there. Okay. So that's suture. Mm-hmm. That's nice. All right. So Delaney's going to do this. We'll get these off. And then Haley's going to come in here. Before you go, we're going to do a final count really quick, okay? So get yourself ready for a final count while you're closing this up. So what I want you to do is, I'm going to show you one, okay?
It's like this, right? And you clip it.
Like this,
pass
just kind of come in like that.
Oh shoot, I'm light.
Use it like these little chopsticks here. Don't you ever use your hands. As you're coming out, you grasp onto it again. And just come on together. But you want to go corresponding, right? You don't want to go over here. So kind of, if you want to use this as a guide, it's fine. Okay. You're watching? So get this as short as you can. And sometimes if you pinch for me, have it start. Pinch. Okay, keep holding it. It's fine. Alright, good. So then we'll just cut it. And do that like one here and then one here for me. It's okay. Do your best. It's just, at this point I want you to try. It's not a big deal. I just wanted you to do that while I'm going to go count with her, okay? And if you ever want to learn, I'll show you. It's not that hard. Trust me if I can do it. Did you take the needle driver?
I did.
Can I have it, please? Here's your scissors. And then she's up here counting, or she's going to just go up there closing it up for me. So once I get to that point, I'll break. Or at this point I won't break, but I'll grab. We're going to go for a count. Laps, go as quickly as you can, but start from the field, the Mayo, the back table. So laps.
1, 2, 3, 4, 5.
Okay, Ratex.
Gotta count out loud.
I haven't started yet. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Bovie.
1 movie.
Sutures.
2 suture.
Can I see them? Start from the field always.
1,
And make your
2.
field Mayo there. So 1,
1, 2.
2. Hypos.
1 hypo.
Hypos. Suction tips.
1, 2 suction. 3 pieces.
Okay. Perforated towel clamps.
2.
Perforated towel clamps.
I only see 2.
I see
There's
2.
supposed to be 4.
Okay. I get start. What is that? Do we have any towel clamps up there? Any on the floor?
Are they in the
Perforated towel clamps.
1, 2.
So 1, 2, 3.
Oh, perfect on first side. And then 4. So there's 4 all day.
Okay, so we're gonna perforated towel clamps one more time.
1, 2, 3, 4.
Okay, non-perforated.
1, 2, 3,
Again,
4.
get used.
1, 2, 3,
Get used
4.
to, and I'm not trying to be start. Even if you're 100% sure it's not back there, just start from the patient. Mayo. Nurses feel more comfortable if you do it that right. Just look up there, look there, and count that way. All right, so good. So Kelly's curved, or let's go with curved mosquitoes.
Now, when I see she's got stuff thrown off over here, should I just walk? Am I okay to walk around her though? Because there's stuff thrown off over there.
Yeah, just try to get her, go back to back. Don't grab it. Go back to back, try to grab it. Doctor, are you using this? No, grab it. Yeah. She might be using it, right? So there you go. So the thing is just realize it's up there and say, doctor, is there scissors up there? And
So
yes,
would we
it
be
is.
counting when a procedure's still going on?
Yeah. That's exactly, because doctor's not waiting on you. He's closing.
Okay.
He's like, I'm 100% sure there's nothing in there.
Gotcha.
Okay, sir, but we still got to count, right? So yes, go up there, visualize it. The assist is on there. That side probably can let you know, hold it up, say yeah. But if the doctor's using it, don't take it, right? Especially if he's closing. Curved mosquitoes, we did that now.
No, we did not.
Okay.
1, 2, 4 curved mosquitoes.
Kelly's curved.
1, 2, 3, 4, 5, 6.
Straight Kelly's.
1, 2. 2
Okay.
straight colors.
Cokers.
Cokers. 1, 2, 3, 4.
Alice's.
Alice. 1, 2, 3, 4 Alice.
Okay, Babcock's.
1, 2.
That's it, correct? Tonsil clamps?
I'm sorry, say again.
Tonsil clamps?
2.
1, 2. So always count 1, 2, don't count by
Sorry.
twos.
1, 2.
Okay. Right angles, you did that.
No, I did not do that yet. I have 1, 2 right angles.
Okay, sponge needle holders.
23 grams.
That's fine. You want more? What's
Sponge
that?
sticks.
Sponge sticks.
1, 2 sponge stick.
Needle holders. Total.
One, 2, 3, 4 needle holder.
Okay. Forceps or pickups.
So 1, 2, 3, 4, 5, 6, 7, 8.
Correct. Knife handles.
2 knife handles.
Retractors total.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
That is correct.
Yay.
We did pull suction around. We did that. Yeah. So, what have you learned from this? As organized you are during this process, the better.
Definitely.
I will go a little quicker than that, but more or less, keep yourself organized. You spend more time with this. This is a problem, right?
Right.
So how can we correct this? I'm not sure. We have to figure out a better tower roll scenario. I can help you with that. But this is, I think, your Achilles heel here, your kryptonite, because you're like,
Definitely. Yep.
let's get this as organized as we can for Haley, and let Haley get in here and fix her own thing. Frankie, you could take a little break if you want a break. That's fine. You want to stay with it. That's fine.
Yeah, I'm going to take a drink, but I'm going to stay.
Well, and I'll get with you a little bit. You did fine. You did fine. And these are small little things. Nervous. And this is not as realistic as possible with that, but you did fine. Listen, anticipate. Suture was a little problematic. Draping in the order, right? That's the only thing I did see. Are there major things that would not make you go to externship? No, of course not. But those are things that you need to work on, even out there, right? So pass it wrong because you had a brain fart. Don't freak out, right? Just correct yourself, learn, get better. Whatever they say, like, hey, why? I mean, this is something you should have known way before. Don't take it personally.
Yeah, of course.
They're going to say stuff, right? Because you're human. You're going to get nervous. You forget. Or you just, like I said, I always have brain farts all the time, right? Otherwise, you did really good, I thought. Look at you, closing out here. What? The appendix is sticking out.
Well, you said just.
That's
I
fine.
thought you said
You did
just do it,
good.
so that's why I
You
was
said
like,
you didn't know
yeah,
how to do this.
I just was kind of not. I didn't actually make
Well,
it. Like,
that's all a
special
suture
or
is.
anything.
No, special not.
Okay. Well, I seen you over here with double loops and pulling, and I'm like, I don't know what you're doing.
Yeah.
Straight
If
Achilles.
you want to learn, I could show you. It's easy.
I would like to learn.
Yeah.
Hopefully, here in the next 5 years, I would like to go back for first assist.
5,
Keisha.
2 years.
Oh, I need a break. I've been in school since I graduated. I need a
It
break.
doesn't take long. It takes a year. And
I know, but I
actually,
need a
the,
break.
the experience or the experience clinicals is you do while you work. So why not just go to school while you're working? And it means $4 to $5 more an hour. Why would you not want to go? And you're more than all of you are more than people doing. Yeah, I hear you. I don't like school either.
We'll see.
I like anatomy
This is
though.
freaking
I don't
me
like
out.
money. And
Is it okay if I go take a drink
yeah,
and
of
break
course.
a little bit?
I would like everyone to try this. What time is it? So we're not.
I'll be back in here.
Because the bottom line is, if you're not comfortable, you guys saw it. If you are comfortable, we can stop. I'm just doing this for your benefit. Because in reality, starting next week, there's no coming back. You're going either way.
I can't.
So if you're not ready, we're just gonna have to go with it.
I can't deal with that. Sorry.
I'm not gonna lie, I feel like being the first assist, it helps. Because you
Ow.
watch it all go down.
Oh yeah, it does. So this is like a
It'll
second.
be okay.
Yeah. So, that's fine. And take your break. You're good to go. It's all for you today. So if you're comfortable, I don't want to, go over something if you're comfortable with it. Wow, what happened back here?
I think the only thing is just, I need to go over the instruments again.
Oh
I'm
yeah.
gonna have all.
Yeah, I'll print that out.
Oh,
Okay,
Natalie gave me hers. I'm gonna make a close note of it.
And that spinning thing is on there on Canvas, but never that even helped. thing. Sure, I came up with that on the whim. That's Chrissy's thing. So let me show you while we're waiting for Delaney if she wants to see. Can I have a foresight? Add to
Delaney.
NC? No, you. I'll show you this.
Oh, usually the tiny. Okay.
You don't want to learn. So, this is,
I hate holding my breath. That is really
Yeah.
actually very hard.
yeah, if you could stab yourself and then what if this person has that?
But it doesn't really like hold on.
I know.
It's very hard.
You have to get used to it, right? This is about manipulating tissue around but not being too traumatic because you can't do like this because you can stab yourself, right? So, it takes a little while, get used to it. It's like chopsticks. You have to use this as an extension, right? Come out. Go in. So, this is made to go like that. So, there you go. Right? Go in. Grab it. You don't have to grab it too much. Just kind of come out. But at the same time, as this is coming, just grab it with this, right?
So it's just enough to hold essentially.
Throw a card, thank you.
Right. So here you do that. What if you? Most people that don't know use this all the time, they'll stop, take it out, they'll use their hands. You need to close quick. And this right. So as you're going through, go click so you can go right to the next motion, right? Oops. Stick in. So you just come right back in. So, let me show you. You can lay this down, that's fine. This is called the home position.
The what position?
Home. This is your home. Right? Every time you start. So this is going to be on this side, right? And that's on that side. So we start here. And we're going to use this as what they call throws. They call these throws. So when I say throws, you're going 1, 2, right?
Okay.
You just turn, and grab the tip and pull it through.
Mosquito
That's called a granny knot.
Oh, okay.
Now go back to your home.
And
Now you just do 1 throw. You
Oh.
start with 2. So you do 1, turn, grab the tip, and go back to the other side.
Is there a reason why you do 2 and then 1, or doesn't matter?
Yeah, it's just that initial one is something called a granny knot. It lays down the knot. I didn't lay that down very well. That's why people pinch. See how there's a big gap there. Start off with 2. It just establishes the square knot. And then you just do 1 throw. So we just did 1, right? And do that like 3 or 4 times, right? Go back and forth.
Oh, gotcha. Okay.
Home, right? Over, home. And you kind of see it without that happening. Back to the other side. Whoops. Right. So typically it's 2 or 3 times like that. And then you cut.
Yeah.
Now with a blade.
Thank you.
Since they're busy. Anyways,
Alright.
suture back.
And that's like the most basic one. I
Yeah,
guess.
that's called a basic.
Besides actually just tying them on.
That's a basic surgeon knot. Yeah. That premise, back and forth, 2 throws, 1 throw, back and forth, is used on every suture technique. You start with that. I can send you a video. It's a guy that he's out of Duke. He had a grant to do a suture video. It really is good. The up close suture, and it goes simple, obviously down the line of vertical, horizontal, and you can just replay it as many times you want. But, obviously, if you're interested. And even if you don't suture, it's a good idea to understand sutures, because if they say, hey, we're going to do an interrupted or vertical, you have an idea what they're doing. Yeah. What's that?
Alright.
How do you, who did that? Frankie? Yeah, okay. Yeah, she was nervous.
Do you want me to throw these where you're going to count? Use these to count?
We're not going to go, we're just going to go through the last stage with Haley. And whoever wants to, right? Because I'm not, if you want to do it, Mariana will do it too. Just so you're comfortable with that final, and see how you are under pressure. Wait. Everyone left.